What do you know about sleep apnea? This is Adcom Foodies TV. If you're just coming across my video for the first time, click on the follow button below and be part of our community. Let's get into it. Sleep apnea is a serious sleep disorder where a person's breathing repeatedly stops and starts while they sleep. These breathing pauses can last for a few seconds to a minute and may happen many times throughout the night. This can affect the quality of sleep and lead to other health problems. There are three main types of sleep apnea, and they are 1. Obstructive sleep apnea (OSA). This is the most common type. It happens when the muscles in the back of your throat relax too much during sleep, blocking your airway. 2. Central sleep apnea. This type occurs when your brain doesn't send the proper signals to the muscles that control breathing. 3. Complex sleep apnea. This is a combination of both obstructive sleep apnea and central sleep apnea. Why and how does sleep apnea happen? Sleep apnea can happen for different reasons, and there are several factors that increase the risk of developing the condition. 1. Obesity. Extra weight, especially around the neck area, can narrow the airway and make breathing more difficult during sleep. 2. Age. Sleep apnea is more common in older adults, although it can affect people of all ages. 3. Gender. Men are more likely to develop sleep apnea than women, though it can affect both. 4. Family history. If someone in your family has sleep apnea, you may be more likely to have it too. 5. Nasal problems. Blocked nasal airways, due to allergies or sinus issues, can contribute to sleep apnea. 6. Alcohol or sedatives. These substances relax the muscles in your throat, making sleep apnea episodes more likely. 7. Smoking. Smoking increases inflammation and fluid retention in the upper airway, which can worsen sleep apnea. 8. Other medical conditions. Conditions like high blood pressure, diabetes, and heart disease are often linked to sleep apnea. Here are some of the symptoms of sleep apnea. Sleep apnea may go unnoticed because it happens while you sleep. However, there are several common signs and symptoms that can indicate you have it. Loud snoring, often heard by others. It's one of the most noticeable signs of obstructive sleep apnea. Choking or gasping during sleep. This happens when your airway becomes completely blocked, causing you to wake up suddenly and catch your breath. Excessive daytime sleepiness. People with sleep apnea often feel very tired during the day, even after a full night's sleep. Morning headaches. This can happen because your brain isn't getting enough oxygen during the night. Trouble focusing. Poor sleep quality can affect concentration and memory. Irritability and mood swings. Sleep apnea can leave you feeling frustrated, anxious, or depressed due to constant sleep disturbances. Why is sleep apnea dangerous? Sleep apnea can lead to a number of serious health problems such as heart disease. Sleep apnea increases the risk of high blood pressure, heart attack, and stroke due to poor oxygen levels during sleep. Diabetes. People with sleep apnea have a higher chance of developing insulin resistance, which can lead to type 2 diabetes. Depression and anxiety. Constant sleep interruptions can cause mood changes and increase the risk of mental health issues. Memory problems. Poor sleep due to sleep apnea can lead to forgetfulness and difficulty concentrating. Accidents. People with untreated sleep apnea may feel drowsy during the day, increasing the risk of car accidents or workplace injuries. How is sleep apnea diagnosed? If you suspect you have sleep apnea, you should see a doctor, who will likely ask about your symptoms and medical history. The doctor may recommend a sleep study to confirm the diagnosis. This study can be done at a sleep clinic polysomnography. During this overnight study, sensors will monitor your brain waves, heart rate, breathing, and other bodily functions. At-home home sleep apnea test. For mild sleep apnea, your doctor may suggest a home test, where you wear a portable device that tracks your breathing while you sleep. How to treat sleep apnea. There are different ways to treat sleep apnea, depending on its severity and the cause. Treatment options may include lifestyle changes, losing weight. If you're overweight, losing even a small amount of weight can reduce the severity of sleep apnea. Sleeping on your side. Sleeping on your back can make sleep apnea worse. Try sleeping on your side instead. Avoiding alcohol and sedatives. These substances relax the muscles in your throat and can worsen sleep apnea. Quitting smoking. Smoking can increase inflammation in your airway, so quitting can improve symptoms. Surgery. In rare cases, surgery may be needed to treat sleep apnea. Surgery options can include tonsillectomy and adenodectomy, removal of tonsils or adenoids, if they are blocking the airway, uvulopilatophys, which removes excess tissue from the throat, jaw surgery to move the jaw forward and open the airway. Medications. There are no specific medications to treat sleep apnea, but if you have related conditions such as high blood pressure or anxiety, your doctor may prescribe medications to manage those issues. Conclusion. Sleep apnea is a serious condition that can have a significant impact on your health if left untreated. It's important to recognize the symptoms, seek proper diagnosis, and begin treatment as soon as possible. Whether through lifestyle changes, medical devices, or surgery, there are effective treatments available that can help you get better sleep and improve your overall well-being. If you think you might have sleep apnea, talk to your doctor to find the best treatment plan for you. Till I see you in my next video, follow @ComFoodies TV for more content like this.